So we are going to go over how to perform thoracic rotations in the seated position. And we really want to be thinking that we want to get as tall as we physically can. So if it's very difficult for you to just sit perfectly on your heels, or you feel like you're rounding too much through your lower back when you sit on your heels, where we get into a position like this, kind of stuck here, it's going to be very difficult for us to perform this drill the way it's intended. So we do need something underneath you in order to perform this the way we want it to be done. Or as my daughter would say, to perform it properly. So I'm gonna sit on a med ball and I'm gonna have that right here underneath my butt. And I will show you this drill from the side so you get a good side view and how to perform it. But this is a drill where we're thinking about winding up the middle of our back and keeping this part pretty stationary. So I will allow my head to follow for the ride, but I'm trying my best to keep my pelvis and my core in the same spot as I go through a thoracic rotation, and utilizing the breath to help me expand deeper into these ranges of motion. So breathing is your best friend in this drill. You can choose to cross your arms. You can have your arms wide. It's totally up to you. I'm going to choose to keep my arms crossed like this, and I'm going to slowly start to favor one side through thoracic rotation, and I'll start to guide and let my head follow. Once I feel like I'm reaching end range of motion, before I have to compensate by overarching my back, rounding, or doing something funky out of the ordinary, then I'll pause here. I'll take a nice big inhale through my chest and a very soft exhale and get all the air out. And I'll repeat that 2 more times. With each breath, we're trying to get a little bit further, and then I'll come back through to the opposite side. You'll probably see that I'm personally a little more limited here. Big inhale through the chest. Soft exhale through the mouth. Sinking a little bit deeper. Repeating that 2 more times, and then coming back to the other side. We're going to be performing this drill for roughly 2 minutes to really stimulate as much tissue as possible in the thoracic spine and through the rib cage in order to really prepare our body to start to move or to enhance range of motion and flexibility through the middle of our back. So what that looks like from the side, trying to stay tall here. Arms are crossed. I turn to my right. I'm not letting my butt shift underneath me. I'm keeping it as stationary as I physically can. Inhale. Soft exhale. Sinking a little deeper. As I rotate towards you, same thing. Find end range. Inhale. Soft exhale. Winding it up even more. This whole time we're really trying to avoid any pinching sensations or anything occurring up here through the cervical spine as far as discomfort goes. So if that's happening, we do want to shorten the range of motion that's being utilized. We don't want to go that deep. So respect your body, respect the signal that it's giving you, and just move comfortably so you can move even more comfortable later.